Good afternoon, friends. This is Dr. Aniruddha Ghosh, General Practitioner in Kolkata. Today, our discussion will be on what is high blood pressure and how to prevent it. Generally, everyone would like to have a healthy or normal blood pressure. But what does it actually mean? Basically, each time when the heart beats, it pumps blood into the blood vessels. This creates pressure against the walls of the blood vessel. This is called as blood pressure. Normally, in healthy person, it rises and falls throughout the day. But when the blood pressure remains high for a longer period of time and left untreated, it can lead to a serious health complication. In general, persistent increase in the blood pressure higher than normal blood pressure is known as hypertension. High blood pressure usually develops over time. It can happen because of unhealthy lifestyle choices, for example, not having enough regular physical activity, obesity, smoking, and stress, etc. There are other risk factors that can also increase the risk of developing hypertension, such as age. As people get older, the arteries can stiffen and narrow as excess of fat builds up. Another next important thing is family history of high blood pressure. One or more close family members with hypertension increases person's risk of developing the condition. Next, most important thing is excess of salt intake is also known to raise the blood pressure. And the fourth one is not eating enough food which with potassium can increase the blood pressure and the risk of stroke and chronic kidney disease. Next one is eating processed and fatty foods can also increase the blood pressure. Another one is stress. Reacting to stress in unhealthy ways or not managing stress can also increase the blood pressure. Moving on to hypertension does not have any obvious sign and symptom. That is why it is often called a silent killer. It puts people at risk for several diseases from cardiovascular problems to kidney failure, stroke and even eye damage and blindness. Hence, early and accurate diagnosis is very important in management of hypertension. Measuring the blood pressure is the only way to know whether the person have high blood pressure or not. Generally, when symptoms do occur, they include morning headache or tiredness, vision changes, buzzing in the ears, fatigue, nausea and vomiting. If person is experiencing some of these symptoms, then one should get their blood pressure checked. Fortunately, high blood pressure can be easily diagnosed. It is usually measured with an instrument called as sphygmomanometer. A blood pressure is recorded in two numbers, that is systolic and diastolic. Now let's try to understand what these numbers actually mean. A healthy or normal blood pressure should be lower than 120 by 80 mm of mercury, or it can read as 120 over 80. Here the upper number indicates the systolic blood pressure, which means pressure in the blood vessels when the heart contracts, where the lower number indicates diastolic blood pressure, which means the pressure in the blood vessels when the heart rests between the beats. If the blood pressure level is more than 140 by 90 mm of mercury, then the person have hypertension. If the person have blood pressure levels higher than this, then she or he might be at risk of developing serious heart diseases. This risk can be prevented and reduced by taking steps towards a healthier lifestyle, such as regular exercise, healthy diet, regular blood pressure monitoring, stress management, adherence to medicine. Now let's come to one by one. First one is regular exercise or physical activity. Exercise can be a drug-free approach to lowering the blood pressure. Regular physical activity makes person's heart stronger. If one have a strong and healthy heart, it can pump more blood in with less effort. So, if the heart has to work less to pump, the force on the blood vessel will decrease and lowers the blood pressure. In another case, as we all are aware, that age and weight gain are the two major risk factors for high blood pressure. So, if the blood pressure is at desirable level, that is less than 120 by 80 mm of mercury, then exercise can help prevent it from rising as you age. Regular exercise also helps to maintain a healthy weight, which in my opinion is an important way to control the blood pressure. One should aim for at least 30 minutes of aerobic activity most days of the week. High BP can be reduced by doing regular structural exercises such as brisk walking, jogging and swimming, etc. Now come to healthy diet. Diet also plays an important role in controlling the blood pressure. A diet with a high intake of vegetables, fruits, and whole grains is recommended for hypertensive patients. For lowering blood pressure or preventing hypertension through the dietary intervention, one can adopt a dietary pattern such as DASH diet. That means dietary approach to stop hypertensive diet, or which we know as Mediterranean diet. Next is eating less saturated fat and total fat. Getting plenty of potassium, limiting the amount of sodium in the diet. Now what DASH diet means? Eating a DASH diet, that is rich in whole grains, fruits, vegetables and low-fat dairy products and skims on saturated fat and cholesterol, lowers the blood pressure by up to 11 mm of mercury if having high blood pressure. Next is reduce the sodium in your diet. Even a small reduction in the sodium in the diet can improve the heart health and reduce the blood pressure by about 5 to 6 mm of mercury if you have high blood pressure. To decrease the sodium in your diet, you can consider the tips like read the food labels, eat fewer processed foods, and don't add salt to your diet. And the next point is quit smoking. This is the most important step in stopping the hypertension. Stopping smoking helps your blood pressure return to normal. Quitting smoking can effectively reduce your risk of heart disease and improve your overall health. And regular blood pressure monitoring is the next step. Some of the hypertensive patients check their blood pressure by visiting the doctors, but it is not always possible for patients to visit the doctors and check up their blood pressure. So, it is advisable to check domiciliary blood pressure while one is at rest or 24 hours ambulatory blood pressure monitoring. Self-monitoring helps the person to measure blood pressure at different times throughout the day and over a longer period of time. Now, come to the next point, that is stress management. By learning how to relax and manage stress can improve emotional and physical health and lowers the high blood pressure. Stress management techniques include exercising, listening to music, focusing on something calm or peaceful, and meditating. And the last point is adherence to medicine. This is the most important step one should follow. A medicine to lower the blood pressure may be recommended by a doctor if your blood pressure is persistently high, usually at or above 140/90. Adherence to medicine is very important as it controls your blood pressure regularly. Lastly, the take-home message will be, we should know the risk factors for hypertension and try to avoid it. And the most important step is adherence to the medicine. If doctor suggests you some medicine for antihypertensive medicine, one should check their blood pressure regularly and take the medicines accordingly as advised by the doctor. Thank you.